We're also thrilled to get the Director of Labor and Delivery at Mount Sinai West, Dr. Desmond Sutton. Dr. Sutton,
wait a minute.
Hang on just a second, because we have just all noticed at the same time that you look very familiar to us. Do you, sir, have a twin?
I do.
Sir, I feel like we're on what's your line now.
No.
Sir, does your twin work for ABC News?
He does.
So
Dr. Darian Sutton, folks.
Is it?
Yeah.
There they are. Well, it is only fitting that we have Dr. Sutton joining us here in studio after Dr. Sutton joined us on Zoom, your brother. I mean, how fun is that?
That was so much fun. I came on this show. Obviously, I love joining you guys, but I also wanted to show my brother that I'm winning. So that is really the key.
Little sibling rivalry. I've never seen that before.
It's only rivalry if there's a competition.
Who's older, by the way?
I'm older by an hour and a half. That's another long story.
Oh,
Yes.
boy, look at you. So can you tell us again how you discovered that he was on this show?
Walking past this show right outside. I was walking past and I said, "Is that my brother?" And I truly was shocked. And then I tried to get in here, but I didn't have access. So.
Probably thanks to your brother.
Yeah,
he said, put him on the no
Lock
list.
the doors. Take a break for one day, and my brother jumps on and tries to take my job.
We're so awesome to have both of you.
Thank you.
Really
It's an honor. It really is.
So great to have you. And you know what? I follow you too on Instagram. I'm tempted to ask you medical questions via
Always.
DM, but now we have you for your medical expertise. So let's talk about COVID and the flu. So there are a lot of new vaccine options on the horizon, like a nasal spray and a flu and COVID combo shot. Tell us more about that.
These are two things that are currently being studied. I think it's really interesting and fascinating because it's opening in this world of accessibility, no longer needing to make appointments and wait on those long lines, especially when pharmacies are becoming kind of sparse and hard to find. So in one world, we have the combo vaccine that's currently being studied. It's a combination of flu and COVID. You get it in one shot. The FDA is currently in their phase 3 trials, which mean that they're opening up, studying a larger amount of patients, working to see its efficacy and its safety. And then something that's likely going to be seen sooner is the flu mist vaccine. And the nasal spray, which is something that exists already. You can get it in the pharmacy, but the interesting thing about this is you might be able to get it at home. So it's a home test that you can get. I think the pandemic has taught all of us that we can take tests at home and we can do it. And so other than Zoom, we can also do our flu vaccines in the comfort of our own home.
But we saw what happened with some Zooms.
We did. And it continued to happen with some Zooms.
Well, you know, we talk about the pandemic, and we all talk about it often. In fact, I know several people within our sort of sphere here, not only at work, but in our personal lives that have had COVID recently. At what point, though, are we going to treat COVID like the cold, like the flu? I mean, are we there yet?
That's that difficult question of trying to figure out when we're stepping into what we define as the endemic phase. Many different epidemiologists will have different meanings for when that starts. Personally, I think that right now when we see these low levels, I don't look at COVID as the cold because I think that I know more about the cold than I will ever right now know about COVID. It's still a novel virus, but overall, a lot of the symptoms we need to just be mindful and treat it just in case. So for example, if you're having that runny nose, that cough, that fever, you don't know if it's the cold, flu, or RSV, or COVID. So therefore, put on that mask, make sure you wash your high-touch surfaces and protect those around you, especially if they're high risk.
Oh, good advice. Can we talk now about that amazing medical breakthrough in cervical cancer? They made the biggest advancement in cervical cancer treatment in 20 years using drugs that we already have. So tell us about this advancement, like what was standard and what this breakthrough really is.
Great question. So cervical cancer, one of the fields of medicine that unfortunately, as you said, has had limited advancements in over 2 decades. In this new study, they found that adding another regimen of chemotherapy before the standard, which is chemoradiation, for those who have advanced cancer, the kind that you can't surgically remove, unfortunately, has shown to reduce the risk of progression and death by up to 35%. Now, that is major in the world of oncology or science of cancer, especially for the many women who are looking for other options when they're getting their treatment.
Yeah, I've had relatives who have suffered from cervical cancer, survived it, but I mean, just the fact that we have these kinds of advancements for any future women who become patients.
And it's also, it's amazing and a reminder, cervical cancer, the average age of diagnosis is from 34 to 44.
So young.
Wow.
It's so important to know that number. That's why screening and prevention need to start earlier. Pap smear, cervical cytology, the age of 21, 25, you get tested for HPV or human papillomavirus. And the most important preventative method for cervical cancer are vaccines. HPV is the most common cause of cervical cancer, strongly associated. Getting your vaccine as young as possible is helpful to protect, and not just girls and boys, because almost everyone's exposed to HPV at some point in their life.
Great advice. Great perspective.
Awesome.
I'm so glad you're at the table.
I'm so happy to be here. Please invite me back.
Now, do you?
I'm missing Desmond.
Well, I'm not.
Well, see, I was going to say, do you have any advice for Dr. Sutton?
Dr. Sutton, get back to work. No, I hope he's watching. I know he's watching.
Yeah,
he's
of course.
Going to be jealous. I can't wait to put this in his face.
You guys are both awesome.
Thank you. I
so
appreciate
much.
it.